we're talking about keeping a long career, right? So we're going to be going through a lot of things that you already know about ergonomics, but going through, like, I feel like I'm so lucky that this is the lesson I got because I have bad ergonomics. I did. And I've only been working for 8 months, and I seriously told my dentist, I'm this close to retiring because it hurts your back so bad if you sit the wrong way. So I've been correcting my ways, and so I'm happy and excited to show you guys some things that will help you to be able to not be in pain, because it is a lot of pain, and even when you're young and healthy, I think I'm healthy, so it can still hurt. So let's see, what do hygienists do? Say a doctor, they're the restorative one, right? What is our main purpose?
Prevention.
Prevention, right? So I was reading this article, and it was saying we preach and preach about prevention to our patients. Floss, you're going to get perio. Do this, you're going to get decay. But then, to think about it, if we're sitting incorrectly and we're doing all these things, patients, perio doesn't hurt, right? They can't see that they're getting it and it's progressing further. It's the same way with us. If we're sitting incorrectly, we can't feel that we are at the moment, but later it's going to do permanent damage that sometimes we can't reverse, just like periodontal disease. So that's why I think this is so important. Okay, so our objectives. Students will identify common musculoskeletal disorders that develop from incorrect ergonomics. Students will identify correct and incorrect patient and operator positioning. Students will demonstrate chairside stretching techniques. Students will know how to apply for licensing in Utah. Students will know the requirements for completing education credits. And students will be able to identify and keep track of qualifying CE classes and credits. Okay, so to start out, a musculoskeletal disorder. So obviously it's a disorder with our muscles. It can be with our bones, ligaments, tendons, all of those things. So these are what cause them. Does that list look like anything we do?
Everything.
Pretty much everything, right? Repetitive. Sometimes at the end of the day I think if I have to floss one more tooth, I'm going to die. Like, we do a lot of repetitive stuff, right? Poor posture. It's easy to fall into poor posture. Ill-fitting chairs. Here in clinic we have such nice stuff. But when you get out in the real world, you might have a dentist that's about to retire and he doesn't really care about his chairs anymore, and you're going to have to figure out how to make it work. So all of these things, psychosocial stress, I think that's how you say it. I looked this up, and does anybody know what that word means?
Dixie down the
That actually came up on Google. Yes, it is something, okay, so what the definition of it is something that it's perceived or it's real, a threat in your mind that you feel like you have no control over, but you have to do it no matter what.
Sounds about right.
Exactly. So, and when I saw this, I thought of like the elderly patient that you know they can't lay back all the way, and you start getting panicked. You know you can't see very well. You know it's going to kill your back to sit like this for you guys for like 3 hours, me for even 40 minutes. It still hurts, you know, but your dentist requires you do it. You need to get the money, so you do it. And your body's in a high stress mode, and that's going to hurt you even worse. So these are all things that can cause it, and that's everything that we do. So we're just going to go over a couple of these because there's a million of disorders, but I just want to go over some of the basic ones. Carpal tunnel. This is where you'll get pain, tingling, and numbness in your thumb, index, and middle fingers. And that's from bending your hand up and down, or side to side, right? And even sometimes I watch myself. Sometimes it's so easy to watch yourself through your loops, but I would take a step back and look at yourself not through your loops, and you can see if you're rocking and rolling, doing the old-fashioned things, because those really are what are going to keep you from doing these bad things. And then continuously pinching. You want to have the soft C shape, not pinching. Ulnar nerve trapment. I thought this one was interesting. Your whole lower arm and your wrist will go numb, and it's just from holding your little hand away from your finger for too long. Like, I know we all want to be dainty. You probably don't want to be dainty, but even when you're cleaning teeth, don't hold your pinky out. Sometimes you can, but constantly doing it it will trap that ulnar nerve and then your whole arm can go numb. Okay, thoracic outlet syndrome. This is where you tilt forward and you hunch your shoulders. This is like my culprit position. I'm always like shoulders to my ears, shoulders to my ears. And I've noticed this in my fingers and my hand and my wrist. Already it's like going numb or tingling, and I'll realize, oh my gosh, you know, I'm only 8 months old hygienist and I already have these problems, you know. So it happens when you compress this plexus right here, the brachial nerve plexus, and so you're hunching and you're always compressing it and it's not getting the oxygen flow. So the last one, rotator cuff tendonitis. This is also one I've noticed in myself, and that's holding your elbows like this. Whether it be around the patient's head or whatever you're doing, but holding them more than 20 degrees is really going to hurt your shoulders. And something I wanted to say before, but how this happens or why this happens, because my husband and his brother always laugh at me and they say, oh, you're just picking teeth all day and you come home and you're so sore. They're like, why are you sore? And so learning about it, it's because our humans' muscles are not made to be constantly contracted. So when you're holding your arm up, you're contracting this muscle, right? So if you're not letting it down and back up and down and back up, it's the blood's staying there, there's no new oxygen, and so you're pretty much suffocating your muscles. So that's why the tendons start dying, the little fibers don't have oxygen and they need that. So that's what happens. That's why we need to constantly be moving and not be doing any really bad constant positions. Okay, so how do we prevent them? Because there's many more than even what I stated. So, keeping your body in a neutral and natural position. This picture is the best picture to describe it. This is how our body naturally goes, right? We have our cervical, thoracic, and lumbar curves in our spine, and we want to keep those no matter what. And a lot of times, sitting, you hunch like this, right? It's way easy to do it. So, I want all of us to sit. So sit in our chairs. You're going to do it with your partner. So these chairs are not. Okay, so these chairs, they don't really, they're not like clinic chairs. It's going to be hard because they kind of give you this curve. But say you're sitting like this, it's easy to sit like this, right? So I know, okay, this is another thing. Miss Wilson taught this class for me. And she told me that Esther was drunk when she wrote this part of our book because it's wrong. And I agree with her now that I've done so much research, because it used to be thought or taught that you're supposed to sit at a 90-degree angle, or I don't even know if I can go 90, but 90 degrees, and that was the healthiest thing. But now there's so much research out there that says you have to be sitting a little bit elevated. See how she's a little bit elevated? I even sit more elevated than her now, because you want to have your legs and your bottom holding your weight. When you're all the way back like this, it's just all your bottom. Your legs can just dangle, you know, and you're putting all that pressure on your back. So a way that you can check it and look at your partner when they do this, you want to try to have your ear, your shoulders, and your hip in a vertical line, straight vertical line. So it's easier to do that when you're sitting up on here rather than when you're sitting back on here. But if you guys sit back on your chair all the way and you're comfortable and you can do this and keep it straight, then keep doing that. I'm not telling you not to do that. But if you have a problem with it, just try it in clinic. Maybe raise your chair a little bit so you're like this and you're sitting a little bit up, so you're putting your weight right here. And keeping the weight on your legs and your bum. Okay, next one. So this is kind of a picture that shows it. When he's up like that, he can keep the 3 natural curves of his back. When you're sitting back all the way and you're 90-degree hip angle, it's a little bit harder and you're putting so much pressure on your back. So these are some new seats in dentistry, which I'm not going to say that you'll have them because they're really expensive. But they kind of, see how she can sit up straight and she's putting weight right here. I know Esther doesn't say this, but this is a lot of the new research. So I just want you guys to go out and research too and feel what feels best for you. If you can sit at 90, keep your back straight, that's good. If you have a hard time keeping your back straight, then raise your chair up, because you might not have a saddle seat but you can still raise your chair up and put more pressure on your legs and not on your back. So, neutral neck and back. These are pretty self-explanatory. You don't want to be bending over too far. You can go 20 degrees, that's okay. Same with your neck, and that's why we have our loops, right? Because you can just be pretty neutral but still see. So that's why our loops help us. This is my biggest one. I hate this. It's like a natural thing for me. Shrugging towards your ears. Just try so hard to keep your shoulders down because, and this is the thing, when Miss Wilson taught me to sit higher, because I told her I was having back problems, my problem is that I didn't put my patient low enough. So I sat higher, but I put my patient up here. So I'm like this. And I thought it was good, and it worked for a little bit, but now I realize, even though you're sitting higher, you have to keep them low, as weird as it feels. This one's a hard one too, but it can do a ton of damage, keeping your arms down, or just a little bit out. Okay, same with your forearms. And when you're doing this is when you have your patient way too high. And that's it said, a lot of things I read is the number one position error is putting your patient's head too high, right here, so that you're bending over like this, you have your arms like this, your shoulders are hunched, and everything goes wrong when your patient's too high. Another one, I don't really know when you'll ever do this, but naturally if you put your hand out, your pinky's going to be lower. If you're forcing yourself to do this, see how my elbow's going out? That's not good. So if you're ever holding your hand in front of your patient like that, just make sure it's good.
When you go to grab your instruments, maybe.
Yeah, that's true. That's
Is that
very
your
true.
thumb up?
Yeah.
Is that what you just go out like this? Thumb up?
I don't know
To
what-
grab your
I can't
instrument?
remember. I was too much work. I can't remember.
Yeah, because if you're reaching like that,
Okay, so first they say you want to adjust the height of your chair. So you want your chair to be comfortable first. Have it be a little bit higher or however it is that you can get your back to be straight. Then second, you're going to lower their chair until their tip of the nose is lower than your waist. And a lot of times the patient's going to say, I'm on my head, and I want to tell them, you're not on your head, let me take a picture of you. You're like 45 degrees up, but you still think you're on your head. So just, if that happens, I mean, this is how I've had to start looking at it. I have to say, they have to be in this maybe a little bit of an uncomfortable position for 30 to 45 minutes. I have to do this 8 hours a day, 4 days a week, sometimes 5. Like, it's going to do a lot more damage on me. And Dr. DeMille, I was talking to him, and he said, when people say that to you, just ask them, oh, so you sleep sitting up? No, they probably don't, right? They can lay back, so you can make it comfortable for them. And with elderly people, it's a lot easier to maybe raise the headrest a little. But that still is not good for your back. But if you have to do it, you have to do it. But at least have them be low enough. Even if they're a little bit up, at least low enough. Okay, so this is another thing that I realized that I've been doing wrong all along. I never knew about this dead space thing. I bet I was taught it, but I was probably doing something else and didn't pay attention. The dead space between the end of the headrest and their head is huge because that's that many more degrees you have to go to find their mouth, to do whatever. So you want them to scoot all the way up. It's easy to tell little kids, scoot up till your head touches my hand, but even with older people, they need to scoot up for you because it's way easier. And then the maxillary arch, when they're laying back, you want their teeth to be their maxillary teeth perpendicular to the floor. So if they're bent forward, you're going to be having to do this. You can't see. And it's going to, you think you can do it for one patient, but if you let it slide, then the next patient does it, and you just, next thing you know, you're just in a bunch of pain, and it's really not worth it. And then for the mandible, it's easier for them because they can put their chin down. That's a more comfortable position for them. Okay, so.
Yeah. Can I just make a comment really quick?
Yeah.
Sometimes for me, one of the hardest things is when you get people that are more overweight because you lower the chair as far as it will go and they're still too high.
Yeah.
Yeah.
And so I was asking my brother who I work for what he does for that because it hurts. I mean, you get done after 40 minutes with them and you really hurt all over. And he said that in patients like that, he'll raise them up and he will stand up. And he will work on their teeth standing. So I've tried that and it works so much better. Less muscle pain and everything if you just stand up.
You just mean because you're trying to avoid touching their stomach or something with your arm?
That and that they're just so high. You're like this.
Well, their head isn't heavy. Well, their body.
Their whole body
Their chest
is
and their shoulders
and their
and stuff.
shoulders are bigger. Yeah, so it's just, if you find that that's painful, then stand up, lift them up, and then get your right position in the standing position.
Yes, that is such a good idea. And my dentist, he probably sits down like maybe 2 patients a day, but he stands up a ton. So I started doing that too when I would find that I just couldn't get them low enough. I would just stand up and then they can be like right here and it's way more comfortable for you.
So if you
Thank
were
you.
to stand most of the time, is that easier on your back?
I
Or would
don't
it
think
be?
so. I think it's better to sit, but if you have to alternate,
Yeah. The hard thing about standing for so long is if you're ultrasonicking, you're kind of like having to balance on one leg and then polishing. So I found that like this leg will start feeling weird or like tingly. So if you could be just standing, then it'd be good. But it is good to alternate. That's just a huge thing, is just alternating and moving positions. So stretching. I always thought they were always like, oh, just stretch in between patients, do this. I'm like, I don't have time. I can't. I'm supposed to do a perio chart in 3 minutes. I take like 2 hours to do this. How am I ever gonna like stretch? That's the last thing on your mind. You know, I don't get paid to stretch. The patient doesn't. So you just feel like you can't stretch. But you just have to realize you can't afford to not stretch because you seriously will not be making money in the future if you don't take care of yourself now. So the benefits of stressing, it decreases your pain, and big thing, it increases the blood flow. You're moving those muscles that have been contracted for so long, so it's letting that oxygen get to all the muscles. Let's see. So I made you guys a printout of some stretches, and I want you to post this somewhere in your offices that you work, or you can memorize them. That's fine too. So pass this around. Let's see. Well, that's not a good one. If you get a bad copy from me, there's some that aren't very good. Is there a bad one over there already?
Yes.
Okay, so it's going to be your guys' job to find a time during class, not during class, when you're working, that you can stretch. My time that I found is we don't have a digital panel, we have one you stick through the developer. So I'll go in the dark room. You need one. Oh my gosh. Hey, I'm going to get you the
We have an extra right here.
You do? Okay. So you get to sneak away into the dark room, and no matter what's happening, no matter how behind you are, you have to stay in there while that panel goes through, right? That's 4 or 5 minutes that you're just sitting there. So I love when I get panels because I just get to go in there and drink my water and stretch, and it helps so much because you just get to reset. So, and sometimes when the doctor's doing the exam, I'll just stand there and kind of be stretching my neck, and they might think you're weird, but who cares, because you have to do it. You really do. So we can go through a couple of these. Some of these feel so good. They all do. Oh yeah, the advanced camel. Yeah, I never knew I was an advanced camel, but I do that in the dark room because your back, you get so sick of doing this, I'll be going like down the back of the wall, doing the stretch because it feels so good. So, and then I wanted to tell you guys about a number figure 10. This is a bad copy, but that little thing, have you ever seen those foam things? Yeah. I went and bought one from Walmart like 2 months after I graduated, and I love it. I just go home and you can just lay on it, and it stretches your back so well. So I would recommend doing that. And then if we have time at the end, we'll kind of go through these because they feel good, but they're pretty self-explanatory. So, okay, we're going to go over some other things. So active ergonomics, that's the whole moving all the time and stretching and doing yoga and relaxation. And honestly, I was never a weightlifter before I graduated, but I have become one because if you can get your muscles strong, then they are going to be that much more used to being contracted or being in a constant position for a while, and it helps so much. And even just running, if you just go out, you guys have probably already felt this, if you just go out and it just loosens all of your muscles. So I really believe that the only way we're going to be able to work for a long time is if we stay really active too. So allowing 5 to 10 minute breaks throughout the day, that's just whenever you can sneak them in. Alternating different appointments. This is huge because some days I'll have really easy patients up until lunch, and then my last patient is like an SRP or whatever, scaling or planing. And I'm so grateful because I'm like, by the end of them, I'm like, oh, I'm done. And then you don't have to do it again. But if you're, and so you need to talk to your front desk about this. Please don't schedule me for patients in the morning of SRP because it's going to kill your back and it just makes you frustrated and mad. And you don't want to have to feel that. There's simple little fixes that you can say, put some 6-month recalls, easy people in between, and it makes it so much better for you, and you're nicer to the patient, you're happier, it's just a better environment. So there's an increase in problems the more hours you work, and the study said that 30 plus hours is really hard on you. And Dr. DeMille was saying to me, because I work 4 days a week right now, and my doctor wants me to do 5, and he said, don't do it. And I said, well, I'm not having kids, so what else am I supposed to do? Like, I may as well be making money, you know? And he said, if you do it for like a year and be done. And he's like, because I've seen multiple hygienists just get burned out and they hurt themselves too bad and they can't go back to it. So you really, I know that sometimes we don't have an option. Like, we need the money. I need the money. So if you need to work that much, then you need to be even better at stretching, and you need to be even better at your posture and sitting like that, because then you can probably make it through. I mean, I know you can. I know a lot of hygienists that do it, but they're really strict on how they handle themselves. So lowering your stress. It is okay to work less and to take time off. I feel like it's just a trait of hygienists to be a little bit uptight, a little bit anxious, a little bit perfectionist. But we just need to realize it's okay. It's okay if you need to take time off. It's okay if there's a dentist in your ward that wants you to work 1 day a week for him for maternity leave, but you just can't do it, and you can say no to him. It's okay. You don't have to work 6 days a week to make it worth it, because it won't be worth it in the long run. So just don't let yourself get too caught up in, I need to make money, because you'll make money. Money always comes and goes, but your body won't. Last one, eating healthy, exercising, and drinking. That's another thing that when you're rushing and doing that, you never have time to drink water. So you have to find somewhere to put a water bottle in your office that you go to. I always put it in, I make all my trays in the morning, and I stick it right by my trays, because then I get to clean my room, wash my hands, and go in there and grab a clean tray, and then I can grab my water bottle and drink it. So you're getting to drink 8 times a day. Because if you don't, you're really not probably going to get your water intake. And I never knew how much water you were really supposed to drink. But they say that you should take your body weight in ounces, divide it in 2, and that's how much you should be drinking. So it's more than 8 cups a day. That's a lie. I think Esther maybe made that up too, I don't know. Okay, so now, you guys mostly have your laptops. We're going to go through how to get your license, because I know this was a huge question for me. So we're going to go to that website, www.dlpl.utah.gov. Okay, is everybody there that wants to be, or just remember? Okay, so for you guys, you're going to be going to apply for a license. Have you guys already done this? No? Okay, that's good.
do you get to that page?
How do you
Apply
get
for
to
a
this?
license.
So let's see. This is the home page.
Mhm.
Then you'll click on apply for a license, right under DOPL online services. Okay, so then you'll go down to the D's and dentistry. You'll click on that. And then that yellow box in the middle is where you're gonna find it. So you guys are gonna be dental hygienist or dental hygienist with local anesthesia. So you can click the word one. On my home computer it wouldn't work though. You had to have a password. So you can click either of them, but what you're gonna do is you're gonna click this. So let's see if this, okay. So, and then you're gonna print it out, because you print it out and you mail it to them. So you'll write on this, and you guys will click the dental hygienist with local anesthesia. And it's gonna be $60. So anyways, you'll go through this. It's pretty much just basic information, your name, your social security number. This lists all other licenses, registrations, or certificates issued by state which you now have or held. In any other profession, you probably won't even have to do anything in that. But if you guys, if any of you are a dentist and you came back to school, then maybe you will have to put in your dental number. I don't know, but I don't think anybody will need to. Okay, the next part, do not write in this section, you don't have to. So then this is all your school information. Your name of your school, the location, the mailing address. Then you come down and you will write the date that you took your national board. So with your board and Reb, you signed up that you want your score sent to whatever state you want to go to, right?
Mm-hmm.
Okay, because usually they're going to mail you something or let you know that you passed, which I know a lot of you guys already have, so good job. I'm so excited. That's the best feeling ever. So, but you can't send in your form of it because that's not official. So these people are going to have to send it, and they should send it, but like I didn't know if mine was sent, so I just called the DOPL number, and it's down at the bottom of this application. After I'd sent everything in, I said, what else is not there? And they're able to say, well, Rev didn't send your anesthesia, or National Board didn't send that yet, so then you can contact them. But it should all be sent for you, but always make sure no matter what. Okay, back up to here. You're going to put in all your tests and the dates you took them, your course name, Dixie, and the date completed. So you can just put like a month and the year of when it was completed. Then go through your CPR. Does this stand for basic life support? What's a C? I don't know. Oh, basic, okay. Yes, so both of those you'll put your expiration date on them. So this record of professional experience as a dental hygienist, you don't have to do that because that's if you were already working and you wanted to work somewhere else. So then you go through this questionnaire and answer all of those. It's about having felonies and drug abuse and stuff like that. So just answer any of that. And then this page, request for verification of license, you don't have to do that. Right, Kim? I don't think, I'm pretty sure this is more. Complete the first section of performance. No, yeah, so you guys don't have to do this, so skip this page. And you'll, if you're going back over this, it says complete the first section of the form and submit it to the state in which you are currently licensed. You're not currently licensed, so you don't have to do it.
Is that something you have to do maybe on when you renew your license then?
It says at the top it's from another state.
Oh,
So I
you're
wonder if
coming
it's
from
if you
another
move.
Okay.
Yeah, that's true. It probably is. Because have you guys heard of like you can get grandfathered in, or what's the other word for it?
Reciprocity.
Yes. Good job. You guys have better memories than me. I already forgot everything.
I forgot everything too.
Okay, so skip this page. Then this page is so helpful because this is your checklist. So, you're going to have to submit an official transcript from a dental hygiene school. When you go online, you're going to, you're going to request your transcripts from the official clearinghouse. I think that's what it's called, or something like that. And you're gonna say, don't send it until my degree and your grades are on there, because it has to show that you have got your degree. So that's probably gonna be one of the last things that gets to them, since you guys have taken your board so soon. Those are probably already getting to them right now, your results. So don't send that until you're graduated. You can sign up for it before you're graduated, but you need to click the button that says post a degree.
With the transcript too, if you request Dixie to send it, it will take longer if you go and pick it up, right?
Oh, really?
Can't you pick it up and it's sealed up?
Yeah, it just has
you
to be
can.
sealed and stamped. You can't
Yeah.
open it.
That's a much faster way for them to get it than to wait for Dixie to send it.
Yeah, that's good. That's true.
How long did it take you to get licensed after you graduated? Like a couple months or just a month?
So I took my boards in the clinical in March, so I was done with everything in March. So I was only waiting on that transcript. So once they got the transcript, it only took me 2 weeks to get it back. So I started working like the middle of May, I think. So it just depends. But
Did the school send your transcript or did you send it?
the school sent it. So, but I do know that the school does take longer than probably if you did it. But the reason why I did that is because I did it before I was graduated, so I could just click that button, send once I'm graduated. So I didn't have to be here after. So then you'll just call them, make sure that they got your national board thing, official score, all of these things. So this is just a really good checklist for you. Because I know there's so much information, you're just going to feel so overwhelmed. But if you have this, you can be asking them all the things if they have it or not. So that will be good. And then you're going to mail it to this by U.S. Mail, Division of Occupational and Professional Licensing. Okay, so does anybody have any questions?
So is this like the same process to renew in 2 years?
That's what I was just going to go to. Perfect.
Well, great.
So I haven't renewed yet, but I'm guessing this button up here I just clicked back, renewal license is probably where we're going to go. And then you have to put in your license number, because you're going to get a license and it will be your number for forever. I think, right?
I don't know how to read it yet, so
I know, both of us are. So hopefully this is how we do
There's
it.
renewal instructions though, over on the right.
Yeah. So I think, because that's something, so with your CEs, I always thought for some reason you had to mail them in to renew. You don't have to. All you do to renew, I'm pretty sure, is mail in a new application and send in the $60 again. Or it might even be a different amount, or is it 60?
I'm not sure.
Not sure. So those are the only things you're going to have to do. The CEs, you're going to do those and file them late, but we'll talk about this in a minute. So, okay, let's see. Back to here.
Do you know how often? 2 years. 2 years for Utah.
Yes. Yep. And so this is the next thing. It's just leading so perfectly. Okay, so still on that same website, this is where we find out about all of our continuing education credit requirements. So let's go back to here and then the home page and then licensing. Oh yeah, licensing laws and rules. Okay, so back to dentistry. Then you're going to be over here under the statutes and rules in the green box. And the one that has it about, this third bullet down is a good one to know, and the fourth bullet down. A lot of them have the same stuff, but this fourth one is the one that we're going to look at. So then you scroll down, and you'll find continuing education, dentist and dental hygienist. So this is like the Bible of the license. So if you stick to this, they can't take away your license. So you're going to need to do 30 hours of CEs every 2 years. Do you guys already know this stuff, or are you not? Yeah, you know most of it? Okay, then we'll just
Well, let's start from what we're saying a little bit, so maybe.
a little bit, okay. So, pretty much, we'll just go through these. 30 hours every 2 years. Let's see, some of these are like, does, like, of course I would do that. But let's see. Okay. Kind of be scrolling through these and see if one doesn't make sense to you. and I'm going to find the important ones. An important thing is that someone is licensed or allowed to give you CEs. So like right here it says recognized universities and college. So Dixie is one. Like for me, the online bachelor's course, you can use that for CEs. That's what I was told from Ms. Wilson.
Vayla, for your bachelor's, so you don't have to even count hours if you're doing a bachelor's, right? It's just, if you're in the bachelor's program, it just counts for
See,
the full 30.
that's what Kristen told me, but I don't know for sure because Ms. Wilson was saying we still had to. So that's a question I was actually going to ask you.
You know what, that's what I've heard too, as long as you're in dental hygiene bachelor's program. Not any degree, but just dental hygiene, that you don't have to do city credits.
Okay, well that's good.
So you would be good for 2 years then?
No, you would just be good as long as you're in school, so it only counts for 1 year.
So say,
So the second year, would you have to do all the 30 credits?
No, 15, I
15
guess.
credits?
Yeah,
Because
because-
1 year would count for the 15, I think.
because your license is always going to renew on an even year. So you guys, it will be 2016. For me, it will be this year. And since I was only graduated for a year, but I'm in the bachelor, so I guess I don't have to do
You
it.
don't have to, so you don't have to do 2016. Okay. Oh, wait, no, that's different, that's city credits, that's not the license.
I know, it's confusing.
So your
I need help
bachelor,
on teaching it.
your CE credits, you don't have to do them if you're in the bachelor's program, but the renewal of the license, you have to
You
do.
still have
So
to
you
do.
have to do your renewal for your license this year.
Okay. But if I go back and get audited, they're not going to say you didn't do CE credits. I'm going to say I was in school and in the bachelor's. Does that make sense?
So she has to do
Yeah.
it.
I don't want to confuse you guys anymore.
So we'll,
So do they
we'll
do
write
like,
on
you know,
that.
like
We'll
every
write for
January
us.
or every December or?
It's every May, isn't it? Every license I've seen says May. I looked at all the instructors' ones in the fishbowl today. I felt so weird being in there. But they all said May, and it's always May of an even year. But don't quote me 100% on that. I'll go.
That makes sense.
I think so. Okay. So maximum 15 hours can be online. It's really nice to do them online because a lot of times they're going to be free. So this is just, you guys can read through this. It's really all self-explanatory because it's so by the law. So you can read through that. We're going to go over some of it too, right?
I know in some of the other states, they actually have the licenses like, expire at different times so that everyone doesn't lose their license at the same time. They don't have a bunch of unlicensed people if they forgot to renew or something, and so they have like, some people have like the off, I don't know,
So
6 month
that makes
intervals or
sense.
something like that.
It should say on your license when it expires.
Yeah, it will.
And so, you know, I wouldn't worry too much about that, just look at your license.
Yeah, you're going to know when it says. Okay. So the main points, let's just hurry through this really fast because we already said it. Renew license every 2 years, even years, send your application, pay your fee. If you don't send in your CE certificates, you just keep them, I would say, in a filing box, and you could have each file for every 2-year period and just have your 30 hours in there. And so then they can audit you up to, it says, keep your records for 4 years after the close of the 2-year period. So 6 years. I would just keep them for 7 just to be safe because you may as well. Okay, so these are ways you can get CEs, and you guys are probably already familiar with this. You can go to the physical classes, which is like a convention, ADA, ADHA, or like I moved up to Logan and I temped at an office and the lady was in charge of hygiene study groups, and they get like different doctors to come and like do perio, CE, or things like that. So you can, wherever you live, just get in contact with other hygienists, and someone's going to have an email or an email group that they all get together, and you just have to be sure that it's someone who is allowed on DOPL to do CEs. And when you do your CEs, they're going to give you a little paper that says the amount of hours, and they sign it, and that's what you save. Online courses, you're going to print it out, and it will say your name, and that will be your certificate. And then hours for recertification in CPR and basic life support do not count towards your 30 hours, so don't hope they will. Okay, so that is everything. I'm going to pass you guys out this test again. Hopefully it's a little bit easier now.
No, I adjusted it several times. It fell once. So.
Okay, does anybody else need a test?